Pain in the back of your knee can be pretty miserable, but luckily the right stretches and exercises can do a lot to relieve this pain and even eliminate it altogether, and that's exactly what I want to share with you in this video today. I'm Dr. Jared, and these are the best stretches and exercises to relieve and even get rid of posterior knee pain, or pain right here in the back of your knee. Now, there are quite a few things that could potentially be causing this pain in the back of your knee. For this video today, we're going to focus on the most common causes, and that's tightness and pain in the muscles, inflammation in the tendon, and then even irritation in that posterior joint capsule. So I hope you get a lot of relief from these. That said, let's jump right in. Now, the first thing that we want to start with is some sort of massage or mobilization to the back of the leg. I'm going to show you on a foam roller. If you don't have a foam roller available, you can also do it with a lacrosse ball or a tennis ball or a softball, also work well. It's important to note that while the pain is right here in the back of your knee, if we're talking about hamstrings, they connect from your hip all the way down, cross the knee joint, and connect into the lower leg. If we're talking about the calf muscles, they start down here at your heel, come up, cross the back of your knee joint, and connect right up here in your upper leg bone, in your femur. And so it's important that we basically get that entire area in order for you to feel as good as possible. So we need to go from the hip all the way down to the ankle. Once again, foam roller is a super easy way to do that. If we're talking about the upper leg, what I like to do is start by sitting on the foam roll. I'm going to foam roll out this left leg right here, so my right leg is bent. With my arms back behind me, I'm kind of in this tripod position where I can support myself or my body weight with my hands and then with that right foot as well. And what we're doing is we're just applying pressure through that left hamstring all the way from my glute all the way down to as far as I can go. That's about the bottom of my hamstring, kind of the top of my knee, and we're gonna go up and back. And so spend 30 to 45 seconds on this area, and then we're just gonna move everything down a little bit. And then I'm going to address right over the back of the knee directly. Again, when we hit this area, we're talking about the tendons. There's a small muscle in there, it's called your popliteus, however you wanna say it. And then also the back of that joint capsule as well. And so we can spend, again, 30 to 45 seconds here, and then we want to make sure that we get all the way down even into the calves. Now with the calves, you can try to kind of get into the tripod again, but again, this leg kind of gets in the way sometimes. Personally, the easiest way to foam roll your calves would be right here, just weight bearing through my arms with both of my calves on that foam roller. If you need a little more pressure, you can also cross the right leg over the left or the non-painful leg over the painful leg to apply a little more pressure through the calf that way. And again, 30 to 45 seconds. We're looking at about 2 minutes of massage or mobilization with that. If you don't have the foam roller available, grab that lacrosse ball or the tennis ball, and then the mechanics of it still look the same. This is smaller, it's a little more precise, tends to apply a little more pressure, so keep that in mind. You might have to unload that a little bit more as you work up and down through these areas. And so that's what the hamstring would look like. We can come down here and again, kind of right in the back of your knee. Be careful, that one might be a little tender, so that might be one that you kind of ease into and apply more pressure as the back of the knee pain starts to feel better. And then again, down right here through the calf. Same parameters apply, about 2 minutes, whichever form of mobilization you prefer. Now that the back of the leg is mobilized and loosened up a little bit, we're going to follow that up with some stretching. I've got 3 for you. The first one is going to be a seated calf stretch. You're going to come into this position, seated with one leg on the ground and the painful leg out in front of you. Either on the edge of your bed or on the edge of a kitchen table also works well. You're going to need a belt or a towel or a sheet or something like that, and I'm just going to loop that right around the ball of my foot like this. Now in this position, what I want you to do is sit up straight and tall, so we're not rounding forward at the back. Sit up straight and tall. You're going to take the tails on that belt or towel, whatever you're using, and pull the foot towards you. That's going to introduce a stretch into the calf. You're going to feel that right behind the knee. But then to take this even one step further, what you can do is just lean your chest forward slightly. And all of a sudden what we're doing is we're stretching the calf, and then with that forward lean, we stretch the hamstring as well, you're gonna get that right behind that knee joint. That one is probably my favorite, or probably the favorite of the patients that I work with as far as targeting and localizing that area specifically. And so you would hold that in a comfortable position for about 20 seconds and then relax, and then we're going to repeat that 3 times. That's again a really great stretch, but it's not always convenient to get into that position. So another one that I like would be a standing hamstring stretch. You're gonna need a small stool or a curb or a stair or something like that. What you're going to do is straighten your leg out and just put your heel on that stair or step, whatever it is that you're using. Again, really good posture, keep your back nice and flat, and then you're just going to lean forward at your hips. So my chest is coming down towards my toes, but again, I'm not rounding at my back. I'm not like lunging down here towards my toes. Keep that back nice and straight as you lean forward. If you even pull your toes up towards you, it kind of mimics that calf stretch that we were getting over here in the seated position. And that's another really good one. That's really good at targeting and localizing right on that area in the back of your knee. Again, a comfortable position, comfortable stretch, hold it for 20 seconds and repeat that one 3 times. The last stretch that I like would be specifically for your calf and that posterior capsule in your knee. This is going to be a standing gastrocnemius stretch, standing calf stretch. You're gonna come into this position, painful leg is back behind you. I want you to glue your heel to the ground. So keep your heel right down on the ground. With my hands, I'm going to push on the wall and then push my hips in towards the wall. So keep your knee nice and straight, keep that heel down, and then I'm going to lunge into the wall while applying a little bit of some pressure through my hands. And that, again, is a gastrocnemius stretch. That's that superficial calf muscle that crosses the back of your knee joint. Just a really good stretch for that area. And 20 seconds 3 times is a great number to shoot for. What I would encourage you to do is figure out 1 or 2 or even all 3 of these stretches that you like, and then perform them daily. Finally, the last thing we want to do is some strengthening to the muscles in the back of your leg, just some muscle activation into the hamstrings and into the calves. These are the exercises that I like to do that. Let's start with just some simple standing hamstring curls. This is kind of like the base level for this exercise. You're going to stand, support yourself, balance if needed, and then we're just going to curl the heel. So pull the heel right up towards the backside, hold 1, 2, and then right back down. So just like this, standing hamstring curl, just get that really good contraction in that hamstring muscle right there, kind of on the back of the thigh. And really, we're gonna repeat this 10 to 15 reps, and we're gonna do that 3 times. So, about 30 to 50 or so reps is a really good number to shoot for. Again, just simple activation of that hamstring muscle. To work the calf, what I wanna do are some heel raises. And so we're gonna come to a stair. We're gonna put just the balls of our feet up on the stair, let your heels fall down towards the ground. And really, that's a good stretch to your calf too. That might feel good to the back of the knee if that calf muscle is the problem, or if that is what's causing your pain. From here, we're just gonna activate the calves. We're gonna lift the heels up as high above the stairs as we can, hold 1, 2, and then slowly return back down to that starting position. Up and hold, 1, 2, and then right back down. And again, you can do about 20 of these. Usually I say, 15 to 20 reps, and we're gonna repeat that one 3 times. And then finally, the last exercise that I like is actually probably my favorite for this condition, would be a single leg deadlift. And so if my left leg were the painful one, I'm going to stand just on my left leg. I'm going to hinge at my hips, and my right leg comes back behind me as my torso lowers down towards the floor. And so we're gonna try to maintain balance. We're gonna get into this position and then use your glute, use your hamstring to pull back into this starting position, or this starting upright position. And so chest goes down towards the ground as the opposite leg goes up, back stays nice and flat, and then we're gonna pull through the glute, through the hamstring, back into this upright position. And the reason why this one's my favorite is you're gonna get a ton of muscle activation out of this. You're really gonna feel that in those hamstrings and through the calf as you work in and out of that deadlift position. Now, if you know you have tight hamstrings and want more help with that, check out this video right here. If calf tightness is the problem, this is the video for you. Click here to subscribe to my channel. I hope this helps you to feel better, and I hope to see you again soon.